Hello everyone, I am Dr. Ravichandran, a senior practicing dermatologist from Chennai. Today we will be discussing on a common topic called hand dermatitis, otherwise called hand eczema, and its the causes and the treatment options. Hand eczema is characterized by dry, scaly, itchy, painful skin lesions, commonly seen over the hands, dorsum of hands and fingers and hands, and impact the quality of life in the women. Particularly it affects the women and men too. Of course, this is a condition which causes difficult day-to-day activity. It impacts the day-to-day activities on these affected individuals. We will discuss the range of treatment options available, including both traditional advanced medical therapy and the effective lifestyle and home remedies in these patients. We will also give you a kind of how to do the skincare management, skincare routine in these kind of individuals, and we have to identify, discuss with about the common allergens which is the causation of this hand eczema, in particularly women who work in the kitchen. This is called the hand dermatitis, otherwise called the dishwasher's hand. So it causes so much impact, the quality of life, day-to-day activities. These women, particularly women, of course it is there in the home. Every woman can develop a hand eczema, and it's difficult for them to do the day-to-day activities. Of course, since men also work in the food industry, and so many contact dermatitis due to industrial chemicals and cement and working environment can cause this condition. So what are the symptoms? It got the common, it very unlikely to be genetic, but it is triggered by the environmental factors, and the common triggering is the allergen. Allergen is a agent which sensitizes the individual, so further contact with the allergen results in a irritant contact dermatitis, cumulative insult dermatitis, allergic contact dermatitis. We classify them into three according to the causation. And we always know the triggering factor. Frequent washing. We have seen this in the COVID times. Many of these patients and women, men and doctors, nurses, everyone developed hand eczema following the excessive use of the hand sanitizer. This is one of the triggering factor which disrupts the barrier function of the skin. So allergens enter the skin, causing a kind of inflammatory allergic reactions. Food sensitivity also is very common. If handling some foods and can trigger this condition, aggravate this condition. Treatment options are very, very limited, but if you have to identify the triggering factor and the causation and prevent these triggers as well as the allergens so that they get a good remission, subsequent flare-ups do not occur. So this is called hand eczema. And what are the common way? See, it's always there in the case of women: soaps, detergents, cosmetics, and the hand sanitizers, chemical industry, cement contact dermatitis, hair dye contact. People use hair color for this hair, and they apply this with their bare hand, so they can get a PPD, paraphenylene diamide sensitivity, and it is also caused by many conditions like atopic. Atopics are more prone to develop hand eczema. Atopic dermatitis is a very common feature of hand eczema. This has to be addressed very well. Emollients, topical steroid, topical calcineurin inhibitors, along with the course of antibiotic, topical and oral, along with the course of antihistamines will prevent this. Once the barrier function is maintained and replaced, they are able to resist the further allergen reaction, sensitivity reactions. And education is very important to the patients affected, and we have to advise a lot of use of emollient, sometimes protective gloves wear and protective clothing have to be done, and avoidance. Most of the time it's a cumulative insult dermatitis to multi-factor, but acute contact dermatitis to hair color, so many factors we easily say. The patient comes and tells you, doctor, I applied a hair color with my hand, I developed severe irritant reaction, form flakes, scaling, fissuring, erythema, redness, secondary infection, pain and pus discharge. They have a swelling of the finger, edema, so that they are not able to do day-to-day activities. So this, please go to your nearby dermatologist. Do not do any self-medication. It's very important because the hand is represented so much in the brain that it is one of the best organ in the body that is so useful. So we have to bring back the condition quickly. Thank you so much.
For more such videos, visit or log into DermaVidya.com.